um, so just to go through a few things about the application form for the Neurology Grid. So just so that I'm sure you're aware, but the interview for neurology and neurodisability is the same interview. And a lot of the time, many trainees decide to apply for both neurology and neurodisability. Obviously, the shortlisting process is a different process for neurology and neurodisability, even with the application. However, the interview is actually the same. So I think the first thing that I wanted to mention was starting early. And I think a lot of us will probably be starting as soon as we've identified that, you know, a certain subspecialties are interest. And starting early just it feeds into the next point, which is commitment to the specialty, which they are really looking out for in the interview. It's commitment and evidence of commitment to the specialty. I think that this probably is true for neurology and a lot of other specialties, most other specialties, is that they're probably looking for a candidate who is who's somebody who's thought a lot about the specialty and this is what they want to do, and have done the things that kind of leading up to that. So rather than something that has, you know, come up very recently or just kind of shortly before the interview, rather. So they will be looking at evidence of commitment to the specialty. And I would advise being aware of that in your application form. Is that kind of putting the evidence that this is something that you've kind of started to work towards at quite an earlier stage in your training, as much as possible, of course. Obviously, if you've decided to go for neurology fairly or neurodisability fairly soon, or you know fairly recently prior to your application interview, it's not the end of the world, but obviously you're just going to need to be aware of that. You would have to really bring that commitment to light. There is another point about previous neurology jobs which I've put here, and you don't necessarily have to have done a neurology job prior to application for Neurology Grid. I started training as ST4. Prior to entering run-through training, I'd done a 1-year clinical fellow post in Paediatric Neurology, and then my 6 months of tertiary neonates, and then I started training at ST4. So in terms of, in that sense, I had done a year of neurology before applying to Grid, but in the sense that it would be beneficial, of course, if you had done a job, because you can bring a lot of the learning points from that. However, it is possible to get a job in neurology if you've not actually done a neurology job, and the key to that is kind of bringing out the neurology in whatever jobs that you've done. For example, if it was in general pediatrics, or whether it was a PICU job, for example, and it's just focusing on the neurology bits of each of those, or whether it's like an emergency medicine job, etc. And of course, neonatal jobs, there's a lot of neurology focus and neurology projects that you can get from that as well. So there is neurology everywhere, I suppose. So yeah, so that's about previous neurology jobs. So don't be dejected if you've not got the chance to actually do a neurology job prior to applying for Grid, because it is possible, of course, to enter Grid training not having done one. Audit and service evaluation is just the other point. Obviously, I know that, I mean, the previous talks have spoke about that at length, but in a neurology specific way, I mean, the things that and as Anna was saying, having an important audit or service evaluation project that has had a good outcome, an outcome that you're proud of because it's made a difference to patient care. It's better to have that kind of put in the forefront really of your audits. So a high quality audit, whether it's related to neurology or not. It's in an ideal world, obviously, ideally you'd like your good quality audit to be something to do with neurology or neurodisability. So the audit that I kind of put at the forefront of that I did was actually a service evaluation rather. It was done during my ST4 job in a general pediatrics unit. So this is just stressing that it does not need to be an audit or a service evaluation that's done in a neurology tertiary neurology unit. It was one that I did during my ST4 post, during my general pediatrics posting, and it was an audit that had to do with the use of EEG for diagnosis of epilepsies in a secondary level pediatric clinic. So the key is identifying where the room is for improvement and change, and I do think that you will find that in your general pediatric jobs. Courses, BPNA, so the British Paediatric Neurology Association, is pretty much kind of, it's, I don't know, the backbone of neurology here. So it's basically, the BPNA is has special interest groups for different subspecialties of neurology, and it has a special interest group for trainees, which actually offers a lot of support to prospective neurology grid applicants. So I would encourage those of you who aren't signed up for that and are interested to join that. And there's lots of resources which I'll link to in a couple of slides. So in terms of courses, the BPNA provides courses, the pediatric epilepsy training courses, which I'm sure a lot of you are aware of, and other courses such as childhood headache, movement disorders courses, and neonatal neurology. So having done these courses is actually a good thing to have on your application form. There is also the BPNA distance learning modules, which could be beneficial if you decided to take them alongside whatever job you were doing. So, for example, there's a neonatal neurology module. You might want to do that while you're doing your level 2 neonates, etc. So just complementing your learning. Presentations. It's good to have presented, whether that's at local meetings, regional meetings, obviously. And the other thing is the BPNA annual conference, which is a good venue for presenting, whether it's posters or oral presentations. There is also the EPNS, the European Paediatric Neurology Society conference, coming up in April, May, I believe, next year. And the abstract submission is open until mid-October, I believe, so for the next few weeks. So that would be a good one if anyone has any ideas for abstracts, because that is obviously an international conference, as well as the BPNA is also considered an international conference. Research, again, as echoing what a lot of my colleagues have said today in previous talks, don't be dejected if you don't have any specific research experience. Actually, I would argue that most of us who go in the grid applications would not have had any specific research experience, and I certainly did not. However, it is getting involved with other things. For example, doing your GCP, and examples that my colleagues have given before. It's showing a kind of a keen interest, and maybe doing things like, for example, shadowing research nurses, etc. So that it's not although it may feel that it's it's a bit tricky to actually fill it in. However, it is important to show that you're keen on getting a grip on various aspects of research, even if you've not had a chance to be part of an actual research project yet. And in terms of feedback on the application form, again, like my colleagues were saying, feedback on the application form, it is important to get feedback from getting it from those who've been through it before, as in having a colleague who was in grid, who's gotten to grid. It doesn't necessarily need to be in the same subspecialty. I mean, for neurology, it's probably neurology and neurodisability, but also generally do get feedback on your application form, and then decide whether it actually is feedback that you find useful or not. So I mean, you'd probably need to be doing a bit of filtering through feedback as well. So the application form is done, okay, and that is almost like, it seems like a mammoth task, but actually the interview is key. Interview is key, really. That was what I took out of my whole grid application process. That if you do your application form, you check it and recheck it and start early and get feedback on it. And then obviously there's the shortlisting criteria, and then you're shortlisted, and then there's the interview. It is helpful to get a mock interview, for example, with somebody, a consultant, or maybe even like a colleague, a more senior colleague, a registrar who's happy to do it. The important thing is getting actual useful constructive feedback. That is, you want it to be worth worth everybody's time, really. So I think one of my colleagues earlier, I think it was Alex, who mentioned about, or Kunal, about having somebody who's invested in the outcome. It is important. What you don't want is to be asking somebody to do a mock interview that are not won't be able to give you constructive or useful feedback for you, because that's just then it's not really a good use of anyone's time. So choose, think carefully about who you want to be doing your mock interview. It's not necessary to do a mock interview, by all means. By the way, I decided not to try to do a mock interview before my application, but that's just me. I didn't approach anybody for it, actually. In the interview process, the most important thing, I think, is just keeping your calm. And that's the most difficult thing, I think, sometimes. Just keeping your calm and just trying to come across as more confident than you necessarily feel at the moment. And that is the trickiest part, really. And when we talk about selling ourselves, a lot of us are not really good at selling ourselves, but I think that the most important thing you can do to sell yourself is appear confident, even if you're not feeling it. And like everything else, it's something that practice helps with. You're usually asked to make a presentation in the grid interview, which a lot of the time you're given some time to prepare it, usually. And that was in the days of the face-to-face interview. I know that obviously it's now all virtual. The presentation is usually, it's usually something along the lines of, it's a kind of a few minutes presentation, 5 minutes or 7 minutes or so. A presentation along the line is, where do you see the future of neuroscience is heading? And it's kind of like, it's an interesting one, because through that presentation, what they're trying to really figure out is how you feel about neurology, or neurodisability, obviously, what it represents to you, how committed you are, how up to date you are with what's happening in the world of neurology, and what is your vision for yourself as well, like as a consultant. Because if you show that you've got a vision for where you think neurology is headed, then you're showing how in tune you are with the area and the specialty. So the presentation is actually really key, and what I advise is doing slides in advance, for kind of, and obviously you'll tweak them around depending on the actual question, but having good ideas about service development, the future, and so on, and shape of training as well. It's now very topical, isn't it? Clinical scenarios. There will be clinical scenarios. They won't be very complicated clinical scenarios. They will be pitched at the right level for your training. But the important thing about these clinical scenarios is the holistic kind of view of it. It's kind of, it's like a lot of it is, yes, clinical management is a part of it, but there's also do other team members need to be involved? What's your risk assessment, communication, and quality improvement? And these are all various aspects of how you will approach things. So in the clinical scenarios, it's not often the clinical management that's a difficult part. It's how to package your response to the question that you're being asked in a way that you come across as a kind of a confident clinician who knows what to do and knows who needs to be involved and knows what needs to be communicated. And looks into other things like, for example, risk management and safeguarding, and other communication issues. The other thing is feedback. Obviously, it's feedback on your mock interview if you decide to go ahead and have a mock interview with somebody, and if in the unlikely event that you're unsuccessful in your grid interview. And I'm sorry, I'm sorry this is something that is, it's a learning curve for everyone. It's important to get feedback and find out what it is that happened. And I do hope that everyone is successful first time round with whatever they choose to do. And I believe that if anybody chooses to do neurology, then they must be really committed to it. So I mean, it's a great specialty, but obviously it doesn't always get a lot of love. Not sure why, but yeah. But I'm pretty sure that those who do want neurology really do want it for all the right reasons. So try to get feedback. Don't be dejected. And in terms of the interview, coming across as confident and decisive and at the same time kind of, you know, asking for opinions and being humble and knowing what you want and why you want it. That is very important to come across as that kind of clinician. Now, there is plenty of support available for prospective applicants to neurology and neurodisability. So the BPNA has a trainee special interest group, which if you follow this link, applying for a neurology grid, you'll actually find links to webinars that talk about the grid application process from neurology. The trainee special interest group is chaired by Mark Atherton and Yusra Hassan, who are our trainee representatives, who are very, very helpful, and you'll find all their contact information on that link. There's a BPNA trainees meeting yearly. There's the annual conference yearly where there is a trainees meeting as well. And again, as my colleagues have said, just go to the CSAC for any questions, really. Our CSAC, the neurology CSAC team are very friendly and approachable and do speak a lot to prospective neurology grid applicants and are happy to give advice. I think that's kind of the summary of where I'm on neurology. Sorry if I've overrun. Thanks, and feel free to contact me for questions. This is my email address. I'm happy to give any advice. If you just contact me on my email address, I'm happy to respond and you know, help with any queries.
Brilliant. Thank you so much, Ala.